So good morning everyone and respected judges. I will be presenting a paper on microscope integrated OCT or MIOCT guided stromal fluid drainage in cases of recalcitrant corneal hydrops. So what is a hydrops? Hydrops is basically there is a breach in your descent layer and the aqueous humor percolates and that leads to corneal edema, stromal fluid pockets and epithelial edema. So what do you mean by recalcitrant corneal hydrops? A recalcitrant hydrops is something which doesn't resolve on medical management or one attempt of intracameral C3F8 injection. This is the normal plan for any corneal hydrops. As you can see here, medical management or surgical management. But if this doesn't work, then we label it as a recalcitrant corneal hydrops. So what are the implications? Why we did this study? Because if you delay the edema, there may be corneal infection, there may be corneal neovascularization, corneal fistula formation, all these complications can occur. So we reviewed the literature. However, in literature there are only few studies. One about MIOCT guided drainage plus compression suture, one about platelet rich plasma, and most of them C3F8. So we plan to say this brings to the purpose of my study, that is to evaluate the role of real time MIOCT guided stromal fluid drainage in recalcitrant corneal hydrops. We did this in our tertiary care center. It was a prospective interventional case series. We included all patients of recalcitrant hydrops from the period 2020 to 2022, and we obtained ethics clearance from the AIIMS New Delhi, and then we did the study. So this is what is the basic steps of the surgery is like. I'll show you a video briefly. So the point is, as you can see in MIOCT, you can see a lot of fluid pockets here. So what we do is achieve an entry-chamber tamponade and then drain these fluids by making MBR incisions. Start from the periphery, avoiding visual axis, and then go till to the lumen of the pocket. So this is a brief video. I'll just skip it. As you can see here, initially paracentesis is made, the entry-chamber tamponade is achieved, and this using a MBR knife, which is guided by your MIOCT, you can enter these pockets and drain the fluid pockets. You can use massage to drain whatever fluid is there, and this is the appearance at the end of the procedure. You can see all the fluids have been drained. So so we took 6 patients for this. All of them had keratoconus. Almost 4 out of 6 had VKC, and 1 was IFC and 1 was Down syndrome. As you can see, the median presentation time, all of them had hydrops for more than 30 days or more than 4 weeks. The median thickness was quite high. It was almost 1625, and this was the post-op outcome. As you can see, almost all of them resolved, and surprisingly, one case resolved within 1 week of the intervention. No, one patient had increased symptoms at 6 weeks, but however, that could be controlled medically. All of them had a scar at the end of the follow-up, and the follow-up period was 6 months. So these are few examples how it performed. When we compare this with available literature, as I said, there was a report of compression suture. Some people have tried DMEC. However, the advantage of this technique is it's a one-time procedure. You need not remove the suture in contrast to compression suture. So MIOCT guided fluid drainage in recalcitrant hydrops is a safe and effective technique. It ensures complete drainage of the fluid, so avoiding all the long-term complications of persistent corneal edema. The limitation is availability of MIOCT. It's not available everywhere. However, you can take guidance from your pre-op ASOCT image, and also you can perform the same procedure. And you are making multiple entries that carries a risk of infection, fistula formation. However, we haven't encountered any such complication till now. So it is a safe and effective procedure, but we may need more studies from more center. At present, I don't think other than RP center, any other center performs this. With this, I will conclude here. Thank you very much.